Hello everybody, we are here to talk about a very important and very interesting topic. It was the first speaker of our plenary session today. It's sustainability in stroke. We have heard that human beings, human activities actually feed into climate change, and then climate change, vice versa, causes more diseases which needs more treatments, and that starts a vicious circle. We're here with a panel of experts. Christian Schulz, from the Klug Institute, the German Alliance for Climate Change and Health, and he leads a group which investigates how climate change and what medicine can do to improve treatment without affecting the climate too much. Stephanie Debet from the University of Bordeaux, who looks into how young patients with stroke and climate change are influenced, and Rustam Al-Shahi Salman from the University of Edinburgh. You are the champion of sustainability at your university. So congratulations to that. And my first question is, am I still allowed to use papers to take my notes?
If you recycle it, Silke.
Oh, right, okay, wonderful. Oh, wonderful, wonderful. So would you mind telling us a bit more about what does climate change do with health, and what can we do to stop this vicious circle?
Well, I think climate change is quite narrow. It's connected to many other Earth systems that are of decreasing quality, and that's why we have health effects in all organ systems, including mental health. So we have to amplify our perspective to come to the right conclusions.
All right, and what can we do? Is there any idea?
You talked about like small steps, and so if people watching now are thinking, we go back to our hospitals, so what are kind of small steps that you would recommend?
I think small steps are not sufficient. I didn't talk about small steps.
No, but I said everyone has to make a difference. That's what I mean, basically.
Yeah, that's the point. But we have to change our perspective away from our personal footprint, including, for example, the perspective within a hospital, within an institution, towards our handprint. So we have an influence that depends on our personal position, including the institutions, for example, and then we have to build new alliances and look for allies in that context that help us to change the conditions.
Yeah. And does this imply, does this imply going to the government as groups, or do you also have suggestions for things that we can implement in the hospital, like just on a department? Which kind of strategies could you implement within a department, say anesthesiology as your department, first neurologists, which kind of...
For example, in anesthesiology, we have very simple tasks we can do to reduce climate impact. For example, we can avoid anesthesia gases. In general, it's complex. We have scope 1, scope 2, scope 3, the greenhouse gas protocol, and therefore from there, different fields of action we must address. The NHS is in a leading role worldwide because they have a transformation path up until net zero emissions. But of course, it always includes building alliances, and that includes to speak up towards policymakers, towards society, because for changes at the end we need majorities.
Maybe, Rustam, can you tell us what you've done in your department to address this, to make it a bit more sustainable, what we do? I mean, we definitely have to go on monitoring patients on the stroke ward. I think we can't switch off all these monitors. We certainly have to treat patients with asthma, COPD. We might change to more modern inhalers. But what else can we do?
Yeah, so I think there are all sorts of dimensions. The first thing is we have to live and breathe sustainability ourselves and lead by example. So I cycle to the hospital and back home every single day, regardless of what the weather is. And we need to signal that to our colleagues and our patients. We know that non-communicable diseases have all the lifestyle risk factors associated with environmentally unfriendly behaviours underlying them. So we can improve our patients' health by implementing low carbon approaches to life. But then how do we actually deliver healthcare that is more sustainable? How do we reduce waste? And there are all sorts of things we can do to look at scope 1 emissions, like how lighting is delivered in our stroke unit. Do we have lights that are motion sensitive, for example? Are we throwing single-use plastic cups away the whole time when we give patients their medication, or using something recyclable? But the most important thing for me in our care is, what are we already doing that is actually not beneficial and we could do without? And that's the uncomfortable truth about a lot of what we do in medicine.
What about these teleconsultations, which more or less started due to the pandemic, and there are now multiple publications saying that actually this is quite climate friendly? Don't ask all patients into a hospital. Do you think this could be something we should think about, or would we lose quality? Is that possible?
Stephanie, what do you think about that?
I'm not so sure, but I'm asking the expert whether it is so climate friendly, because it is entailing also a lot of server use, and so I don't know. And I think we should definitely not relinquish or abandon very essential aspects, which are the contact with patients. And I do think, if there is a convenience for the patient to have remote consultations, and we have seen that there are some situations where this is the case, that can be done, but I think essential things need to be kept. But I'd like to come back also to one comment that you made, which I found very important, that we have also a responsibility as physicians and experts to report on the impact of climate change and environmental changes on health to the policymakers, because this may have an impact and maybe sponsor change, or at least promote more rapid action. And perhaps we need to do more research on the impact of climate change and environmental transitions on, in particular, vascular brain health, because I think there is not that much data available on that. And certainly, we need more research to be able to report more groundbreaking results that will have a broader impact. What do you think? This is something that we have a responsibility for?
No.
Okay, I misunderstood.
So.
Maybe.
No, not at all. But I think the evidence for what is going on is amazing. We have a huge evidence of what will happen. We have evidence about climate tipping points of the Earth systems. We know the relationship to the burden of disease, and we have a more or less a little understanding of how these interact and how this could lead to a disaster, including, especially in the healthcare system, being the first line of defense in this context. So I think we have enough evidence, but it's a normal reflex, as I said in the talk. The surgeons want to reduce waste, and the researchers want to do research. That's logical, because it's what they know, what they are able, what's their business. But apart from that, we have to strategically look for the biggest levers, and these are the social tipping elements, and then we have to analyze our environment, our networks, and look for the multipliers.
Mm-hmm. So you're talking about research, and Rustem, you are doing a lot of clinical trials, and so so you also mentioned that during the talk that doing research is not always so sustainable. That also comes with sort of an element of waste sometimes, and so how do we need to think about the design of clinical trials and sustainability?
So the first way to reduce the carbon footprint of clinical trials is to not do clinical trials that do not need to be done. Let's only do big, large, practice-changing trials that are methodologically sound. We saw during the COVID pandemic two things: a fantastic response to the problem and the use of virtual methods in trials, lower carbon methods of recruitment, consent, follow-up, that can reduce our carbon footprint in future. But we also saw an infodemic, a lot of very small trials that were unnecessary and not well conducted. So we need to reduce what we do and do what we do well with a small carbon footprint. And finally, if we really want to make maximum impact, the interventions we should be researching are ways of delivering healthcare more sustainably.
Which discipline would you think is the leading discipline in medicine regarding the carbon footprint? Is there anything?
Hard to say. I think it's not the anesthesia.
Not the surgeons we heard?
No. It's diversified across disciplines, across countries. It depends on networks. It depends on personal relationships, for example, and this is how this evolutionates in the different regions and context.
So we always talk about sustainability regarding climate change, but sustainability sometimes a little broader than that, and I think about the statement of the United Nations. Stephanie, what do you think about that?
Yes, I think it's really important to consider sustainability as part of the United Nations Sustainable Development Goals, the 17 Sustainable Development Goals that I'm proud to wear, because I think if we want to make a difference, of course, climate action is essential, but we have to think of other sustainability goals, which include equity, which is very important, a major question for stroke, which maybe can be achieved by partnering in a more global fashion, and also engaging into educational activity that have a more global scope. And we were delighted to have several invited speakers who were also teaching us about stroke care and stroke research, high-level stroke research in Africa, where sustainability has another meaning, another dimension. We were just discussing with Dr. Schulz how urban health plays a major role in health in general in many places, but increasingly also in the global south and developing countries. And I think we have to think globally. It was wonderful to hear also the impact we can have through the session with WHO and thinking of our global European scale impact, but also on the broader international scale. I think sustainability is a very broad term, and I think we can contribute by improving equity in stroke care, stroke prevention, stroke research more globally.
Yeah, absolutely agree. But on the other hand, we all have, as you said, we have to start with ourselves in our departments on a very small basis, because then that was your last slide. One person pushes
triggers the next one.
Yeah, exactly. Otherwise, we will not.
I think that the narratives about sustainability are not very strong. All these sustainable development goals, they are all interconnected. So if we address one, we address all the others, because they are connected. Yes. So what I think is much more helpful is to talk about resilience. We need to talk about the resilience of healthcare systems in the next 10, 20 or 30 years. And then we are able to draw the right conclusions for that, what we have to do in the next couple of months or years.
Yeah.
I think that's one more point. Stephanie, go ahead.
The 17th Sustainable Development Goal is a partnership for the goals, and I'm coming back to your comment that maybe, and also your comment, maybe we should do less trials, or maybe some that are not necessary can be replaced by global coalitions to try to partner and improve the situation through interdisciplinary collaborations and partnerships.
Yeah. But I find it's still quite an abstract topic. So if we now to our audience, what would we recommend as what can they do when they go back to hospital next week?
This is the same question. It's the same question every time we talk about this.
Yeah,
what is concrete measure they do when they go home? That's difficult because, as I said, the perspectives are different, the disciplines are different, the professions are different. The power everyone has differs between one from the other. And that's why it's important always to see the bigger picture and to put in the big context. At the beginning, this is not concrete, but if you have this in mind, it's more easier to come to concrete
solutions and actions. Yes,
and collaborate, right? If they go back home and start collaborating in the hospital to work on that goal.
That's very important, because if you work alone on this topic, it's very hard for your own mental health, and that's why you need friends and allies to stay in your own comfort.
And to start the discussion also.
Yes, definitely.
Then,
I think that's a great message for all people watching, and to take that message home. And I hope that you will enjoy the rest of the day at the conference today, but also tomorrow.